Okay, now this is PYT number 4, that is food poisoning, which we are discussing here, and we will discuss it in a scenario base. Okay, this year PYQ. So, first two cases we have to remember that they have short incubation period. In end, we'll discuss like which have short and which have long. That's it. Okay. So card number one, case number one is this picnic potato salad. Here, the scenario we have is this teen develops projectile vomiting within this 2 to 3 hours after eating mayonnaise-based potato salad, which is kept at room temperature. This room is also important. Okay, so mayonnaise, we know, projectile vomiting and 2 to 3 hours. So what is this like etiology? Bug, staph aureus, and this is intoxication. This we have to remember. This is not infection, this is intoxication. This is also important to know which is infection, which is intoxication. There is this preformed enterotoxin. So that is the super antigen, and incubation period is short as 1 to 6 hours, and features we have to remember is mainly vomiting more than diarrhea and no fever. And toxin ka character, that is this preformed enterotoxin is heat stable. This is also important, and diagnosis is mainly clinical because it has very short incubation period, no need of culture, and treatment is just supportive, no need of antibiotics. And now the question is, how can we prevent it? What can we do to make sure this doesn't happen again? So should I refrigerate it? Yes, we should do refrigeration, and hand hygiene is also important because nasal carriers are there responsible for this. Now the second case we have is this reheated fried rice. So here this word is very important. This reheated word is very important, and fried rice also. So here the case is this college student eats fried rice, okay, from a street vendor and develops vomiting in 2 to 5 hours. Okay, and here the etiology, this bug is Bacillus cereus. So cereus we have to remember. So how can we remember it? Like Bacillus cereus, we can remember like bheja fry. Okay, bheja fry people are quite serious. They are quite serious. So for bheja fry is a fried rice. Okay, they are serious, and serious people want everything fast. They can't be slow. Cannot imagine them being slow. Okay, so incubation period here is this 1 to 5 hours. This we have to remember. Okay, here there is also toxin, and this is also preformed, which I have already earlier also mentioned that this first two cases have this incubation period small and preformed toxins. Because why this incubation period is small, and the reason is that this toxin is already formed, preformed, that is cellulite toxin. And here the feature is again this emesis, more than diarrhea and no fever. And this character we have to remember, this toxin character is heat stable. Again, diagnosis we can do food and stool culture, and their treatment is again supportive. Prevention, we can do this proper storage of this cooked rice. Okay, now third scenario will go, that is this canteen meat curry. Okay, canteen meat curry. So the scenario here we have is this multiple hostel students develop watery diarrhea plus cramps 8 to 16 hours after eating meat curry in the mess. The bug responsible is this Clostridium perfringens type A. So how will we remember? Like Clostridium, we'll remove the C, like lost in eating this tasty meat curry. We know that canteen food is not tasty, but okay, we can say here if they are lost in this canteen mutton curry. फिर क्या? फिर क्या means per fringens, per क्या, per fir क्या, फिर क्या, that is like फिर क्या, disaster na, that watery diarrhea and cramps. So here again this toxin is this enterotoxin only, but here the incubation you can see is 8 to 16 hours. How? Why? Because this toxin is not preformed, here it is made in the gut. Okay, so features we have to remember here is this diarrhea more than vomiting, no fever, again self-limiting within 24 to 48 hours. So we have to remember the spores characters, that this Clostridium perfringens is a spore former, and again heat resistant. Okay, so diagnosis is this stool and food culture, and we do this enterotoxin assay we can do, and treatment is supportive only. Prevention, how can we do the proper cooking, avoiding reheating large meat dishes. So this is how we have remembered. Now next, home canned beans. So adult develop blurred vision, diplopia, ptosis, dysphagia after eating home canned beans, descending flaccid paralysis, no fever. So everything is so bad, the neurological involvement we see here. Okay, so the bug is Clostridium botulinum. So canned food, like anything in the question mentioned related to canned food. So bottle can, we can remember like this. Okay, here the toxin is preformed botulinum neurotoxin A to G. This is preformed, we have to remember. This is preformed, this is preformed, this is preformed. And but incubation period here is this 12 to 36 hours, because it is so like so disastrous, na? It is taking some time. It's not coming like nausea, vomiting and diarrhea. No, it takes a time, 12 to 36 hours. Feature is neuro involvement leads to paralysis, not GI. And we have to remember, like, everything is bad, but still it is heat labile. Toxin is heat labile and blocks this ACH release. Okay, so ACH release will not be there, then what will happen? Okay, you know what will happen. So the diagnosis we do is this toxin detection in the serum and the food. And how do we treat is this antitoxin, ventilatory support, no antibiotics we give except if there is wound botulism. How can we prevent it? Like proper canning, boiling home canned food. Why is like boiling? Because it is heat labile. And special case is this infant botulism, which is due to this honey exposure. Now this undercooked chicken. So now the case is this child develop fever, abdominal pain, diarrhea, that is bloody diarrhea, 12 to 72 hours after eating undercooked chicken. So how will we remember? Like bug here is salmonella, enteritis non-typhoidal. This is important. So how will remember? Like here will remember there is this meat salan. Somebody cooked this meat salan. Okay, cooked but undercooked. Undercooked meat salan. This is due to this salmonella, and that leads to this infection. Okay, this food poisoning, and this type is this infection, not intoxication. Incubation period again 12 to 72 hours. Feature is diarrhea, fever, cramps, stool culture. Treatment is supportive, antibiotics only in severe and systemic. How can we prevent this? Proper cooking and hand hygiene. And now this important, this pregnancy. Anytime in question this pregnancy word is mentioned. Okay, this raw milk cheese. How can we, like, question can come like pregnant women eat unpasteurized soft cheese, develops flu like illness, meningitis, baby develops neonatal sepsis. So the bug, pregnancy, listeria, monocytogenes, this we have to remember. Again, the type is infection, that is intracellular. Incubation is days to weeks. Flu like, meningitis, sepsis in neonates, taking some time. Okay, so meningitis taking some time, can take some weeks also. Blood CSF culture is done. Treatment is with ampicillin, gentamicin, because meningitis na. So how can we prevent this? Avoid unpasteurized dairy, cold stored meat in pregnancy. This is important. Now we have this, okay, raw oysters, coastal trip traveler develops profuse watery diarrhea, and especially it will be mentioned rice water stools, no fever, eating raw oysters, after eating raw oysters. So Vibrio cholera, the toxin name is choleragen, increase the CAMP levels, leads to watery diarrhea. Incubation 12 hours to 5 days. Features is this severe watery diarrhea, dehydration, stool. We know this diagnosis. We use this TCBS agar. Okay, for stool culture. And treatment is ORS, IV fluids, tetradoxy, shortens the course. And safe prevention is the safe water and cooked seafood. And one is the special seafood picnic, where this undercooked shellfish history is given. Okay, watery diarrhea, cramps after 8 to 12 hours. And this Vibrio parahemolyticus is involved, is again infection. This is infection. Okay, so 8 to 12 hours is the incubation period. Watery diarrhea, abdominal pain and fever will be there. Again, diagnosis TCBS, stool culture, supportive. And we can prevent it by cooking the seafood properly. So short incubation period, that is 1 to 6 hours. We will remember the Staph aureus, Bacillus cereus. And again this emetic type, vomiting wala. Immediate 8 to 16 Clostridium perfringens. Clostridium lost in eating meat. Meat what? I think canteen meat curry. And fir kya? Fir disaster. Okay, like infection and all, watery diarrhea, cramps. this disaster I'm talking about. Bacillus cereus. Diarrheal wala is intermediate. Emitting is just short course. Okay, longer we have this 12 to 72 hours where we have the salmonella, vibrio, E. coli and listeria. And neuroscience with no fever is botulism. Pregnancy risk, pregnant anytime given, is listeria. HUS with E. coli 0157H7. So this is how we have finished all the food poisonings. Anything left you can share with me. You can tell me. I've kept this discussion open. You can tell me in the comment section. Okay, thank you.